IDEA is intended to ensure that children with disabilities have their unique needs met and that they are prepared for further education, employment, and independent living. We hope that as you go through a presentation with us, that you will have a more clear understanding of how the process works. Today, we will navigate the individualized education program process for families. I am Sue Ellen Bates, an education consultant for students with mild and moderate disabilities with the Louisiana Department of Education. I work in the Diverse Learner Division along with Dr. Lauren Miley, who is also an education consultant for students with significant cognitive disabilities, who you will also hear from today. We often hear teachers and parents say that regardless of quality instruction, certain students struggle and have difficulty learning. Supports and interventions are put into place, but more information is needed to further help those struggling learners. Sometimes beyond those daily supports, schools have to take additional steps to ensure all students are learning. We know that it's critical to provide the support so that all students have access through a process for identifying students with disabilities. Students can begin this process as a result of the child find activities or referral by any educators or parent to begin the identification process. After initially being flagged by Child Find, an educator or parent's referral, the child's case will be referred to the School Building Level Committee, or SBLC, as it is most commonly referred to. The SBLC will lead a comprehensive review of the student's data and then determine the next steps. One option is to proceed with an evaluation for special education by a multidisciplinary team. Based on that evaluation, a determination is made regarding eligibility. Even if a student doesn't qualify for an IEP under IDEA, the SBLC should continue to develop intervention plans to support a student whose needs are not being met with perhaps a Section 504 plan. If a student is identified as eligible for an individualized education plan, the IEP team then meets to design the supports and services the student needs to succeed. We will soon go over a list of individuals that will be part of that IEP team. After the IEP has been developed, the school will go about providing supports, which could involve placement in specialized programs or engagement with specific related service providers. Annually, the IEP team will reconvene to review each child's progress, develop annual goals, and provide the plan with updates as needed. Most critical throughout this process, beginning when the SBLC considers a student who has been referred, parents are engaged, and the department has several supports to ensure families are able to participate meaningfully throughout the process. Let's talk a little bit about the evaluation process. I know it can be overwhelming because there are so many steps involved. Understanding the process can alleviate that stress. Once a student has been identified by Child Find and the SBLC has decided that an evaluation is needed to determine special education eligibility, the pupil appraisal team will conduct assessments and interviews and gather data to determine if the student will qualify for special education services according to the Louisiana Bulletin 1508 criteria. The evaluation takes place using multiple methods that follow the Bulletin 1508 criteria. Remember, this evaluation is the starting part in a student's 1508 journey. It determines whether the student has a disability, as well as what additional services may be needed to help the student be involved and progress in the general education curriculum. To further help you understand the timeline, once the school gets your request or referral for an evaluation, they will contact you. If the SBLC determines that it is necessary to proceed, you will be contacted and invited to participate. As a parent, you will be invited to participate in this discussion and all others regarding decisions for your child. If the SBLC determines it is time to proceed with an evaluation, you will be given a consent form for the evaluation and a copy of the procedural safeguards, which describes the processes and your rights. Once you give them the signed consent form, they have 60 school days to complete the evaluation. You will be part of the IEP team to determine services needed to support your student. This IEP will be written within 30 days of the determination of eligibility. Now that you understand the purpose of an evaluation before beginning special education services, let's discuss some of the key components of that evaluation. There will be some initial screening activities. The evaluator will examine those screening results along with other test scores, discipline and attendance records, classroom grades, and statewide testing results. The evaluator will compare those findings with any other reports given by parents and outside agencies. It will go over any interventions previously put into place and the existing data that accompanies those interventions. Your role as a parent is critical in this stage in the process. Be aware, be involved, and always share your concerns. You know your student better than anyone else, and your voice matters. Be sure not to withhold any information that will be helpful to the evaluator. The evaluator will interview and observe the student. Then the evaluator will issue a formal assessment to the student. Lastly, the evaluator will review all of the data to create a report and determine findings. Upon completion of the evaluation, a meeting will be held with the family to discuss the results. In this meeting, the family will receive a copy of the evaluation results. The evaluation team will discuss the evaluation results and other information about the student and determine whether the student qualifies with a disability. During this time, the family will participate in the determination of the educational needs of the student. The school must obtain consent before providing special education and related services to the student. After the student has been evaluated and found eligible, a meeting will be held to develop an individualized education plan, or IEP, to provide special education and related services in the public school. An IEP is the document that is developed to meet the specific and unique needs of the student. At the IEP meeting, the family will work with the school representatives to determine the special education supports and services that will meet the needs of the student. Now that you have the results of your student's evaluation, it will be time for an individualized education plan to be written, and a meeting will be held to develop that IEP. An IEP is a document that is developed to meet the specific and unique needs of the student. At the IEP meeting, you will work with school representatives to determine that special education supports and services that will meet the needs of the student. You are a very important part of the IEP team, and your input is invaluable. The student's school will take steps to make sure you have the opportunity to participate in the creation of the IEP. According to the Individuals with Disabilities Education Act, an IEP meeting must be held annually. At this meeting, the team will look at the data from the goals and determine whether or not they are being achieved. The IEP will be changed or updated to include new goals, new evaluation information, and any other relevant information about the student. Remember, an IEP is a fluid document. It can and should change constantly as a child reaches milestones, masters tasks, standards, and new circumstances arise. Progress is monitored often to see what is working and what needs to be changed. Remember, you may request an IEP review meeting at any time in order to revise the IEP. If you feel that services aren't adequate or that your student is not progressing, you can ask to review the IEP again. You may be wondering who you can expect to be a part of a student's IEP team and what is a stakeholder. A stakeholder is anyone who may affect or be affected by a decision, activity, or outcome of the IEP. There are certain individuals that must be invited to participate in the process and some that may be invited. Let's discuss the difference. The following people must be invited and allowed to participate in the IEP process and meeting: the parents or legal guardians of the student, an officially designated representative. This is usually a member of the school administration, general education teachers, special education teachers. An evaluation coordinator is required for the initial IEP meeting. Sometimes you'll have the following people in the meeting: related service providers, such as adapted physical education teachers, occupational therapists, physical therapists, speech pathologists, behavior interventionists, psychologists, and social workers, the school counselor, pupil appraisal, and the school nurse. Having all stakeholders involved in the IEP decision-making process allows for the most clear picture of what a student needs. If the team is creating a map to follow, having all the experts weigh in will create the most effective use of accommodations, supports, and resources for the student. The collaboration that occurs during the building of an IEP is invaluable to that diverse learner and his or her unique needs. An important aspect of including the student in the IEP planning and meeting process is teaching personal responsibility for learning along with self-advocacy and self-determination. All team members will bring different information about the student to the meeting, so all the perspectives are important. Meeting as a team creates buy-in and ownership for implementing the program. Each stakeholder has a different perspective and a different role, but each member of the team is valuable to the success of the student. Consistency and collaboration are critical for meeting all components of the IEP. So, let's talk about your role as a parent or guardian. Your voice matters. You know your student better than anyone else. Parents are encouraged to be an open and curious member of the IEP team. Ask questions. Be sure that you are understood. Be sure that you understand and say what the student needs and advocate for appropriate goals and services. Share information. Talk about your student's hopes and needs. Most certainly advocate for the student. The other members of the IEP team want and need to hear what you know about the student. Knowing what to expect as you prepare for the student's IEP meeting can take away some of the stress. So let's talk about what to expect. At least 10 days before an IEP meeting, parents will be contacted with a date, time, and location in which the IEP meeting will be held. Within a few days of the initial contact, parents can expect to receive a letter from the school noting the details of the IEP meeting. This will include all participants that have been invited to attend the meeting by the school. Parents are asked to sign and return the letter and also note any additional individuals they plan to bring to the meeting. Now, an IEP consists of many different sections. We're going to discuss a few of them today. The GSI, or General Student Information page, should help provide a snapshot of the student. This is the first page of the IEP and the first thing a stakeholder reads to get to know the student. The parental concerns are invaluable in relaying what a parent would like for a member of the IEP team to know about their student. Parents should plan to be very detailed here. The student's present levels of academic and functional performance are sets of data that state how your student is currently performing. In this section of the IEP, you will see information about the student's strengths and needs, comments about how the student is doing in the classroom, results of any standardized tests, and any other areas of concern that have been identified. The instructional pages are where goals are written. IEP goals are the specific skills that the IEP team want to see the student accomplish. Goals are written based on the student's current levels of performance and should be measurable. Goals should help the student make progress in the general education curriculum and can be reasonably accomplished in 1 year. Goals can be academic, behavioral, social. They can address the needs of self-help or anything educational. A description of how the goals will be measured and how the school staff will track the student's progress is also noted. If the student is participating in an alternate assessment, there will be goals and objectives that support that assessment. Accommodations or changes to the educational environment that allow students with a disability to overcome the barriers created by their disability. These pages will offer classroom and testing accommodations, such as preferential seating, extended time, calculators, and more. The minutes section is where the school must provide a free and appropriate public education for the student in the least restrictive environment. This means that to the maximum extent appropriate and possible, the team should figure out ways for the student to participate in a general education setting. This part of the IEP also includes an explanation of the extent, if any, that the student will not participate in the general education class, such as in a resource setting or a severe profound setting. Other factors to be considered: supports and strategies for behavior management, language needs for English learning students, Braille needs if the student is blind or visually disabled, communication needs for a student that's in need of speech therapy, health needs during the school day, assistive technology devices or services. I know it's a lot, but there are many resources available to you. Many of those resources will be linked for you at the end of this video.
So as you've now heard, there are many different components and moving parts that occur during the IEP meeting. And having an understanding of those parts and the building blocks of the IEP can help to better understand the entire IEP process. During the meeting, the evaluation will be reviewed to determine what supports the student may be eligible for. Placement will be discussed, which simply refers to where the student will receive their academic instructions. The student services will also be reviewed to determine what additional services or supports may be necessary to help that student achieve their academic goals. The present level of performance will be discussed, and that refers to how the student is progressing on tests, the student's classroom performances, even behavioral challenges or other pertinent data. And then the IEP goals that the student will be working on throughout the IEP school year. So that now leads us into the discussion of IEP goals. We've already reviewed the different components and many components of the IEP. And one of those main components of that IEP are the student's goals. IEP goals are statements that describe what knowledge, skills, or behaviors a student is expected to achieve within the IEP year. The IEP team writes measurable annual goals for the student. Now, these aren't the only areas that the student will work on throughout the school year. Rather, they are targeted goals in specific areas of need that support the student's academic progress. The family members' input here helps the IEP team develop and refine these goals, so they're not only realistic, but also ambitious. Keep in mind that parents, by law, are equal members of their child's IEP team. While the parent or caregiver might not be an expert about special education, they are an expert about their child, and their input helps the team assess the student's skills and develop those IEP goals. Setting IEP goals ensures that the student and teachers have something concrete to work towards, while also holding that school accountable for addressing the child's unique needs. Annual IEP goals should be measurable, should also align with the student's present level of academic and functional performance, and that's through the use of pertinent data, should enable the student to be involved in and progress in the same curriculum as children without disabilities, their typically developing peers. The IEP goals will be based upon the unique needs that are described in the present level section of the IEP. And that present level of performance is what is going to drive the IEP. The results of the student's evaluation determined the present level of academic performance and educational needs. And those needs decide the IEP goals. Measurable goals will guide monitoring of progress towards meeting standards and also provide information for assessing the appropriateness of services. So, for example, the student might qualify for speech therapy services or even occupational therapy, and that's based on the present level of academic performance. That same level of academic performance might then decide if the student is ready to be dismissed from services. So it's assessing the appropriateness of those services. And goals should always be accompanied by a method of reporting the progress to parents, and that's typically done through progress reports. So there are so many components that the IEP teams will include when designing IEP goals to meet that student's specific needs. IEP goals will always include the who, and that simply refers to the student. The time frame then refers to the length of time the IEP goal might take place, and you may see it written on an IEP as by the end of the IEP year. The conditions are the behaviors that may occur, such as the student independently performing a task, or maybe the student needs a certain amount of help or assistance with a task. The behavior then refers to what that IEP team is wanting the student to do. So perhaps reading questions, answering comprehension questions, or even reading fluency. And then the criterion is referring to the accuracy level that the IEP team thinks the student can perform a task, and when they consider the IEP goal as being successfully met. And sometimes you'll see this written in an IEP as 80% or higher for that accuracy level. So accommodations can also be found on a student's IEP based on that student's unique needs. Accommodations allow a student to complete the same task as typically developing peers, but with some variation in time, format, setting, and even presentation. IEP accommodations are adaptations or changes in the educational environment or practice, and they help a student overcome the barriers presented by their disability. Now, accommodations can be broken down into several categories, and these might include presentation, which is simply a change to the way the information is offered to the student. There are also response accommodations, and that refers to a change in the way the student completes the actual assignment. Environmental is adjusting that setting where the student is completing the assignment. There are timing accommodations, which simply adjust the time that's allowed for the student to complete that assigned task. And then lastly, organization, which refers to tools that the student might use to help manage time, organization of those assigned tasks. So depending on the unique needs of the student, you may also read about and see that related services are included within that student's IEP. Now, there is a very extensive list of related service personnel and supports that can be provided, but some of these common services might include speech language therapy, audiological services, counseling, physical therapy, interpreting services, occupational therapy, and even special transportation. So we know that the IEP process, it can be overwhelming, especially in the beginning. And then hearing that your student might need additional services and additional supports, this can simply add to the concerns that many parents and caregivers often feel. But there are different service providers that are common within an IEP, again, based on that student's unique needs. And some of those service providers might include the occupational therapist or physical therapy, adaptive physical education, speech therapy, psychological services, special transportation, or even assistive technology. During that IEP meeting, you also may reference different supporting documents within the IEP. That IEP team might review the Individualized Health Plan, or IHP, as well as a Behavior Intervention Plan, or BIP, a Communication Plan, or even an Assistive Technology Checklist. These supporting documents are based on the student's unique needs, but the Individualized Health Plan, or IHP, this is typically developed by the school nurse in collaboration with that IEP team, as well as the student's physician. And this plan is outlining specific healthcare guidance for that individual student. The BIP, or the Behavior Intervention Plan, again, based on that student's unique needs, But this is a written improvement plan that's created for the student based on the outcome of a functional behavior assessment. And that assessment is identifying any challenging behaviors that the student might experience. And it also specifies the actions to take to help improve or replace those challenging behaviors. The communication plan, this is a tool that was developed for students classified as deaf or hard of hearing, deaf, blind, for students that have limited or no verbal skills, or have other significant impairments in the areas of receptive and or expressive language skills. And for these students, this is a tool that was used to determine the student's current language and communication needs, and to establish an individualized communication plan, which will ensure that the student is able to fully participate in all aspects of their education. Assistive technology refers to an item, a piece of equipment, software program, or product system that might be used to increase, maintain, or even improve the functional capabilities of a person with a disability. And the assistive technology, or AT checklist, is used to document the physical, fine and gross motor, communication, sensory, academic, recreation and leisure, and even vocational and self-help areas that assistive technology might be considered, which can enable a student with a disability to access the general education curriculum. It's also important to note that during the IEP process, that IEP team will consider whether a student with a significant cognitive disability might qualify for an alternate assessment. Again, the qualification here is for students with significant cognitive disabilities. And there are two tools that have been developed to determine the eligibility for an alternate assessment. The K-2 Alternate Assessment Participation Decision-Making Tool, this was intended to guide and support those IEP teams in annually determining whether a student's in grades K-2 will be most appropriately assessed with an alternate assessment. Whereas the 3 through 11 participation criteria was established to support those IEP teams making alternate assessment decisions for students in grades 3 through 11. IEP teams will use these tools annually to consider participation in an alternate assessment. So if your student qualifies as a student with significant cognitive disabilities, that eligibility criteria may be discussed during that IEP meeting. So this now brings us to our final discussion of this presentation. We have a great overview of exactly what the IEP can do. We've discussed many of those components. We've discussed what happens before the meeting as well as during. And it's important to keep in mind that the IEP is an accountability tool that will identify how the resources of a school need to be configured to support the student's unique needs. It also will ensure that a strategic and coordinated approach has been made available to address the student's needs. The IEP will guide the provision of instruction designed to meet those unique needs of the student, while supporting the participation of the student in the general education curriculum and learning standards. And lastly, that IEP will even prepare the student for their adult life. So we know, again, there are many components of an IEP. There are many details that you will likely hear throughout that IEP meeting. Please keep in mind that you're never alone in this journey. And there are numerous resources and even support groups available to help you within this process.
I know it's a lot to take in, but don't get discouraged. Remember to celebrate the small wins. Some days will have bigger growth than others. As a student moves along this roadmap, things will change. New goals, new data, new situations come up, but flexibility is key for everyone. Progress monitoring and data tracking are essential in making individualized database decisions to update IEP goals and provide updates to families. Don't forget, progress is progress, no matter how big or small.